My name is Courtney Spees, and I'll be doing the Ibd case study on Mrs. Hale. So Mrs. Hale is 19 years old. She came into the emergency department reporting bloody diarrhea, and she said that she has already been told she has IBS and that she sometimes has bloody stools, but she's seen a lot of blood in this one. So questions I'd ask her would be her family history, her diet, her alcohol consumption, her BM regularity, her water intake, and then if she had any unexpected weight loss. So I would enter the room. I'd go ahead and look at Mrs. Hale, see how she's sitting, see how many side rails are up, make sure her bed's lowered all the way, make sure she has her call light, make sure she has her side table, and then I'd also look for any drains, lines, anything like that. And then I'd also look for oxygen. So if she had any oxygen, I'd note how many liters she's on, and then the delivery method. And then I'd also make sure that she doesn't have any clutter at her bedside or to the bathroom or to any of her exits. So the first thing I'm going to do is ask her name and date of birth, and then I'm going to look at her ID band and make sure that's correct. And then I would ask her to go ahead and lay down for me. First thing that we're going to do is check Perla. Okay, and then I'm going to have you turn your head to the right, to the left. No JVD was noted. I'm going to have you wiggle your fingers for me. Okay. I'm going to go ahead and check her pulses. Okay. Present. Push. Pull me. Then I'm going to check cap refill. And while I'm checking cap refill, I'm going to go ahead and look at her skin pallor. It's pink, warm, and dry. Alright, so cap refill is good. So the next thing that I'm going to do while she's lying down is go ahead and do her respiratory assessment. I'm going to go ahead and listen to you. Have you had a cough lately? No? Okay. Alright, Miss Hale, can you sit up for me, please? I know you're in a lot of pain, so I'll go ahead and help you. Okay. Gonna go ahead and listen to her back now. Stay up. Alright, I'm gonna go ahead and listen to your right arm. Or lift your right arm and listen. Your left arm. And I'm going to go ahead and have you take a deep breath. I'm going to place my arms like this. Okay, your chest is symmetrical. Okay, you can go ahead and lay back down. So the next thing I'm going to do is ask her about her abdomen, which is our primary assessment right now. I'm going to go ahead and ask if she's been having gas, when her last bowel movement was, what consistency that was, and she already told me that she had bloody stool. So the first thing I'm going to do is inspect her abdomen, just looking for any cuts, burns, bruises, anything like that. Then I'm going to go ahead and auscultate. Since she already told me her abdomen is tender, I'm making sure that I'm not putting her in too much pain. Now that that's done, bowel sounds were present in all 4 quadrants. I'm going to go ahead and palpate as well. Once again, making sure that I'm not causing too much pain for her. Okay. Are you having any painful urination or discharge? No? Okay. The next thing I'm going to do is ask you to wiggle your toes for me. Wiggle, wiggle. I'm going to feel her pedal pulses. Okay, they're both present. I'm going to do cap refill. Each toe, push, and pull. So, some discharge instructions that I would include for her would be to stay away from alcohol. That could be highly irritating to the GI tract. And since after my assessment, they said that she had a colonoscopy, so I included some things for a DC for a colonoscopy as well. So I said expelling air from the rectum is normal after a colonoscopy since they inflate your stomach with air. I said watch for chills, fever, persistent vomiting, severe abdominal pain, or bleeding, and if you have any of them, to come back and notify your healthcare professional immediately. And then I said try to eat a bland, soft diet so that it would not cause any more irritation to her digestive tract while everything is healing. Hello, so continuing on this assessment, I'm going to go ahead and give an IM of the Bentyl. It is a antispasmodic, and some side effects can include dizziness, drowsiness, lightheadedness, weakness, blurred vision, and then you would also want to watch for severe constipation, bloating, stomach pain, worsening diarrhea, and confusion, hallucinations, or other unusual thoughts. So what I'm going to go ahead and do is prep the med. So I'm going to wash my hands and put gloves on. Beforehand, I would also explain the procedure, or explain why I'm giving this to the patient, explaining what it's going to do, explain some common side effects, and I would also do patient identifiers, so ask her name and date of birth, and then check her ID band. I would also check doctor's orders before I went and got this to look for the dosing amount. So the first thing I'm going to do is go ahead and open up an alcohol prep pad. I'm going to grab my solution. I'm going to clean the top off with the alcohol prep pad. I'm going to safely uncap the needle. I'm going to pull up air. Now with my non-dominant hand, I'm going to raise the vial and then carefully, making sure I'm not poking myself. Okay, so I'm going to inject the air now. Sorry, I'm trying to let you see. Inject the air, pull up that medication. Trying to ensure no air bubbles. Okay. So I'm going to tap, tap, tap. And then I'm going to go ahead and, since my patient is behind me, I'm going to go ahead and recap that needle. Okie doke. So I have another alcohol prep pad right here. And then I have my medication. We're just going to pretend that's a clean table. So the first thing I'm going to do is ask her which hand is dominant. So she said right, so we'll give the injection in the left since it can sometimes make your arm sore. So first thing I'm going to do is find the identifiers. So I'm going to look for the acromion process, which would be right here. Then I'm going to go 2 finger lengths down. And so I would be giving the shot about right here. So now that we've isolated that area, I'm going to go ahead and open my alcohol prep pad. Going to cleanse the area. I'm going to let that alcohol completely dry. I'm going to ask her to relax her arm. And then to make this injection a little bit easier, I'll be utilizing the Z-track method. It can kind of help lessen pain. So what I do then is use my non-dominant hand. So I'm going to go ahead and open my needle. my non-dominant hand, pull back, still kind of isolate where I'm wanting to do the injection. And then I'm going to use a darting motion at 90 degrees. 1, 2, 3. And then I'd slowly inject the medication. About 10 seconds per ml. And then I'm going to take that needle out. I would safety cap the needle, but I reuse this needle for education purposes, so I'm going to safely scoop that needle back. And then I could put a band-aid over it. But this little buddy doesn't need a band-aid. And then afterwards, I would document how the patient tolerated it, which the patient tolerated it well. And I would document the date and time. I would document the medication, how much I gave, where I gave it, if there was any kind of like site reactions or anything. I'd also document how the patient tolerated the injection, and then I'd also document what type of needle, like syringe, I used. So I guess the only thing left now is handoff. So Mrs. Hale came in. Came into the ED. She reported that she had some bloody stools, but she already knew that she had IBS. She ended up having 5 to 10 bowel movements daily, and she already had 3 that morning. She ate greasy foods, and she had reported a weight loss of 10 pounds in the last 4 months. I went ahead and gave her some Bentyl to kind of help her, Bentyl to help with spasms, and we went ahead and did a colonoscopy. It showed a bleeding ulcer in her transverse colon. He cauterized that, but there was no other signs of bleeding, so he went ahead and sent her home. I gave her some discharge instructions, like not to drink alcohol, that expelling air from the rectum is normal after colonoscopy, to wash her chills, fever, persistent vomiting, severe abdominal pain or bleeding, and trying to eat a bland, soft diet. To not irritate her digestive tract anymore. She came back, and she had bright red blood in her stool, and she had 2 bowel movements yesterday and 5 today, and then she was reporting severe lower abdominal pain, nausea, and vomiting. She had some sores in her mouth, and she was complaining of epigastric pain. He went ahead and did an endoscopy, a repeat colonoscopy, and a CT, and they determined that she had Crohn's disease. So he sent her home with some medications, and a couple of them that I would expect him to discharge her with would be some anti-inflammatory drugs like corticosteroid to help reduce inflammation. Sometimes those don't work though, so maybe an immune system suppressor that would help target the immune system's response to inflammation, so that would also help lessen the inflammation, and then an antidiarrheal to help add bulk to that, to help add fiber, which would bulk up her stool, which would then decrease the amount of diarrhea that she has. So yeah, that is about